Good day and welcome to our webinar, Hypertension Using Technology to Improve Health Outcomes. Today's presenters are myself, Selena Williams, and Phoebe Nelms.
Good afternoon, everyone. So glad you could join us.
Thank you, Phoebe. Today's objectives are define the importance of addressing hypertension management to improve outcomes, review suggestions for utilizing electronic health record data to identify and manage patients with hypertension, identify benefits of implementing a hypertension management quality initiative. Let's define and discuss hypertension, why it is important to prioritize hypertension management as focus for your practice. Hypertension is the pressure of blood pushing against the walls of your arteries. If it remains high, it can cause a lot of damages to your heart, brain, and other organs. Hypertension management is personal to me because I have hypertension and also both maternal and paternal family history with hypertension, which unfortunately has not had great outcomes for some of my family members. A normal, so this guide right here shows you healthy and unhealthy blood pressure ranges. A normal blood pressure reading is less than 100 and less than 80. The systolic, 120 and less than 80 for the diastolic. And elevated is between 120 and 129 and less than 80 for the diastolic. When an individual's blood pressure reads 130 to 139 for the systolic or 80 to 89 diastolic, they are considered to be in stage 1 of hypertension. 140 over 90 or higher is stage 2 of hypertension. And hopefully at this point, you are seeing your physician for some hypertension management. Because at this point, we know it's serious. And we all know that this is a silent killer, and most times individuals do not have any symptoms. Measuring and monitoring your blood pressure is the only way to know if it's elevated. So it's very serious and very important to make sure that you measure and monitor your blood pressure. Okay, so we're going to talk about the prevalence of hypertension. 47% or 116 million adults in the United States have hypertension. That's nearly half of adults. Only 1 out of 4 of those adults, which is about 24%, have their condition under control. About 1 in 5 adults with hypertension is unaware of it. That's most people, or they just choose to ignore it. High blood pressure was a primary or contributing cause of death for more than 516,955 people in 2019 in the United States. A higher percentage of men, of course, is 50% have high blood pressure than women do, which is at about 44%. So these statistics present a large opportunity to impact the current and future health of patients in your practice. This is why we should prioritize hypertension management as a quality initiative and explore the tools available to help identify and manage these chronic conditions. So we're going to talk about some impacts of hypertension on health outcomes. Uncontrolled high blood pressure can lead to, of course, heart attacks, heart failure, strokes, kidney disease, vision loss, sexual dysfunctions, and of course, hypertensive crisis, peripheral artery disease, pain, and fatigue. Although risks increase with age, adults who have hypertension before age 40 years are at even higher risk of having a cardiovascular even later in life. Early intervention can head off development of additional chronic conditions and their costs to the healthcare system. Okay, so we've shared a little bit of information as of what hypertension is, how it can impact the outcomes, the health outcomes, if you don't manage this properly or get it management properly by seeing your primary care. So we have a polling question. Why prioritize hypertension management? Why is it important? So I'm going to share this poll and give you guys a few minutes to. Okay, so about, of course, 100% said why prioritize hypertension management, because nearly half of US adults are living with high blood pressure. 0% said that. So everyone answered at 100%, all the above. Nearly half of the US adults are living with high blood pressure. Despite knowing the devastating effects of uncontrolled blood pressure control has worsened. is also a critical component of providing the highest quality of care and equity. So all of the above, thank you guys for participating. So the last 2 years we've all been freaking out and preoccupied with COVID-19. COVID has been like the bully in your neighborhood or that bully at school that has put so much fear and anxiety into our lives. However, it also highlighted the importance of addressing underlying conditions. Let's talk about some of the tools to help us focus on improving hypertension management. What tools can we employ to undertake improvement in hypertension management? I think we can all agree that the first step in diagnosing and then treating high blood pressure begins with getting an accurate measurement. I really like this concise reminder of resources from the AMA to keep these 7 tips top of mind for all clinical staff. So we'll just go through this little chart. Again, we retrieved this off the American Heart Association's website. They have a lot of great resources out there for physicians and patients actually. Accurate blood pressure measurement is key to both estimating cardiovascular disease risk and guiding management of blood pressure. By avoiding common errors, your team can provide correct diagnosis and provide quicker treatment, improving blood pressure control rates. Using correct cuff size. If a cuff is too small, it adds 2 to 10 millimeters of mercury. Don't have a conversation when getting your blood pressure taken. Talking or active listening can also add to inaccurate readings. Empty your bladder first. Full bladder causes inaccurate readings. Also make sure your back and your feet is supported and that all that is in accurate standing, because that also has an effect on how your blood pressure reads. Keep your legs uncrossed. Cross legs, that also is an issue. Support your arm and heart level. Always have it down when they're taking your blood pressure. They tell you to kind of put it down so you can get an accurate reading. Put your cuff on bare arms. Cuff over clothing also can be a discrepancy in the reading of your blood pressure. So this is a great little chart that demonstrates and gives some great tips for your staff. The importance of measuring accurately. Of course, we know blood pressure variability exists in everyone. Sometimes individuals are experiencing white coat effect. Maybe they've had too much caffeine, or it could be what they've had for breakfast prior to coming to their visit. The next slide gives a little more sources of blood pressure measurements and errors that exist. So we see many sources of blood pressure measurements error exists. Of course, they could be patient-related. As I mentioned, it could be what you've eaten prior to coming to your visit. Here we see alcohol use that can play a major factor in how your blood pressure readings are determined. Nicotine, bladder distension, cold exposure, and of course, white coat effect, which we all know that's a popular one. A lot of us get really nervous when we go to the doctor's office and it gets our blood pressure all off whack. Some that are related to devices is the device model or inaccuracy, device integrity and the calibration. Like for instance, for example, my mom, she's 83. I have her living with me, and so I have to take her blood pressure. And her blood pressure was out of whack, so we had to call the fire department. They said, okay, this blood pressure cuff that she had is not working. You need to take it to get it calibrated. So that's very important if you're doing self-monitoring and checking your blood pressure at home. You want to make sure those machines are calibrated. Procedure related, insufficient rest can play a factor in that. Again, how we discuss your body, how your body is positioned, legs crossed, unsupported back or your arm. Also, the wrong cuff size, taking the measurements while you have on clothing. They suggest that you do it on your bare arm, using bell or stethoscopes. Rapid cuff deflation. So here are just a few of some of the measurements that can cause your blood pressure readings to have an error. And so inaccurate measurement techniques is common. In a systemic review, a large bias was associated with 27 out of the 29 potential resources. So 27 out of 29 of these resources is what has caused most individuals' blood pressures to read inaccurately. Okay, so here is blood pressure measurement training skills and competence. Regardless of the device or method, blood pressure accuracy relies on the competence of or the observer, the person that's taking the blood pressure. Training and skills assessment should include patient preparation and positioning, just some of those that we mentioned on the previous slide, selecting the appropriate cuff, obtaining accurate and representative results, documentation and communication. And so I'm gonna share a little video that we got off the AMA also about self-monitoring and kind of doing when you're doing your blood pressure at home. Oh. Okay.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the US have high blood pressure and are at high risk of stroke and heart attack. So self-measuring is one of the easiest ways to proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm test. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit with your back in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or anything. If you need to use the bathroom, make sure you go before you do the Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check the two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers, so you can discuss the numbers, and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
So that was a great video. Everything that we discussed, she was up in the right position in her chair, sit in a quiet place. All those play an important factor when you're taking your blood pressure. So here is this is a slide of some new practice resources and education. I would drop these. This presentation will be available to you guys, but I will also drop these in the chat so you can snag these links for resources to take back and use in your practices. So we're going to talk a little bit about enabling self-management, teach backs. So a method to ensure and improve a patient's understanding of his or her condition, diagnosis, and medical regimen, prognosis, or treatment plan. It's always good to put stuff like this in place for the patient so they can kind of understand. Because, you know, most of the time, I mean, I've worked in healthcare for quite some time, so I understand. But people that are not familiar with certain health terms, they don't understand. So putting things like this in place is very important for patients that are oblivious to what needs to be done. So after the healthcare provider relays their disease-specific information, he or she asks the patient, caregivers, or family members, tell them what we've just discussed. So give them a teach back of what you've discussed about medications, appointments, their lifestyle goals, what your expectations are for them to improve their blood pressure. Present the visit summary ahead or visit and have the patient review the medications for you. Make the visit summary speak to the patient in their language as their health literacy level. Like I mentioned, they are not familiar with the medical terms that we're familiar with as clinical staff. Use recall functions to support patients with self-care goals. Call them, email them, text them. Just follow up with the patients to ensure that they are following these teach back steps. Upload motivating patient education tools into the EHR for easy print. So these are some of the qualifications, uploading, motivating. If the patient has a patient portal, you can upload this to the patient portal for the patient to be able to easily access. Okay, so as we come towards the end of kind of talking about the technology piece and assessing your practice, this is something else I snagged from the American Heart Association website. So like I mentioned, they have a lot of great resources. And this slide, of course, is a guide that you can assess to assess your practice. And also, so it talks about measuring accurately, act rapidly, partner with patients, and then of course, self-measured blood pressure. And with that being said, I just kind of want to mention, Phoebe and I are working with the Department of Public Health to assist practices in identifying and managing patients with hypertension to utilize their EHR. You know, a lot of practices are not really using their EHR to the full capacity to identify and manage these patients. And that's what we're here for, to help you assess your EHR, to see how you can enable some of these tools within your EHR. Are you using your dashboards? Are you using your templates that are in your system? That's what we're here for, to assess your EHR tools and see how you can use them. We will be a liaison between you and your vendor to see what needs to be done. So if you are interested in participating in this project, we've had some great outcome with some of the practices that we've assisted in the past and that are currently participating. Just reach out to myself or Phoebe for next steps. I'm going to turn it over to Phoebe to talk about quality measures and the valuable guidance and feedback.
Thank you, Selena. That was a lot of information that you covered that was very practical for keeping this top of mind, because as you said, with COVID, so many other things that we know are important sort of get put in the background. So we thank all of you for attending our webinar to, you know, just keep this topic top of mind, keep it on the radar. And one of the things that can help practices, and many are required to actually report, those who are quality payment program eligible clinicians, we know that they have to report these quality measures. And as the healthcare system overall makes this transition from fee-for-service to a more value-based payment model, really, it's the practices that stay ahead of that curve that will see the less negative impact on their reimbursements. And of course, the primary thing is taking care of patients, making sure their outcomes are the best we can possibly support them to achieve. So as we, you know, Selena brought to our attention, the managing of hypertension, it really can be a powerful lever to improving health outcomes for our populations, because it is the predecessor to so many other health injuries. So if we move on to our next slide, we'll see a few of the, just a few of the quality measures, but these ones we picked out are clinical quality measures and electronic clinical quality measures that are related to hypertension. Specifically, 236 talks about controlling blood pressure, and it's a high priority measure in the MIPS program. And also quality ID number 317, preventive care and screening for high blood pressure, and then documenting the follow-up of that, as well as the other measures that you see on your screen. So the use of specific hypertension-related quality measures, it can really help a clinician to track their performance, how they're being measured. And these measures are included in the quality payment program, as well as other value-based payment agreements. And so the performance measurement, in most cases, you can see how you're doing when you pull up your EHR, your electronic health record dashboard, because if the information is put in for that related measure, then you can just take a quick glance on a regular basis, maybe weekly, maybe monthly, so that you can see, well, is the information showing up in the report? You may be doing a certain activity, but is it actually being captured by the system and then reported, so that you can make any adjustments and not miss out on the opportunity to make an impact on your performance. If you just wait till the end of the reporting period, not much can be done to make any changes then. And so we know that these electronic clinical measures were developed specifically to allow the electronic health record system that's certified by the Office of the National Coordinator for Health Information Technology to more easily capture and export and calculate the measures to CMS. And so we can see how that list on our screen of measures, they can work together. They work in tandem to help improve health outcomes. Hypertension, similar to smoking or obesity, they really are key unfavorable health metrics that can have downstream really negative health implications. And unfortunately, the psychology of human nature suggests that we really are more inclined to improve what we measure. And so measuring hypertension, as mentioned, in the correct way to get the correct reading, and then creating a diagnosis that, if applicable, but also measuring performance on all the measures together, really, it can help you create a baseline and then have a goal. And that way you can assess the patient's progress and how your practice as a whole is performing. So these quality measures are tools that can help us to achieve those goals, because they're tracked by the EHR. That's one way to use the technology. And then also by looking at your population level data, you can also identify maybe some gaps, some patients that might be falling through the cracks in some areas. So there are many opportunities to use the functionality that exists in your electronic health record to help improve the outcomes for the patient. So as we move on to the next slide, I don't know about you, but I kind of like real world examples. And I appreciated all the ones that Selena mentioned, personal application. So as she mentioned, we've been doing some quality initiatives around hypertension with a couple practices, and it's been really very rewarding. One practice in particular is working on implementing an algorithm to identify patients who may be hypertensive, but just haven't been diagnosed. And so that's been a wonderful tool. And also generating the ability to generate reports to identify those patients that need maybe an intervention to come in to be seen again is a great use of your technology. And so through this they're able to reach out proactively to those patients who might be in need of some intervention, and find out, well, what is the barrier they might be experiencing to medication adherence, or help them connect with other community resources that help them meet their health goals, and then establishing a good follow-up schedule. And then I really like this example of Dr. Edwards. I'll read it for you. Now, Dr. Edwards recognized that regular office visits with patients were taken up by clinical work and that her patients with high blood pressure needed extra attention. So her practice staff used their electronic health record system to identify patients with a body mass index of 27 or higher. And then they sent letters to those patients asking them to come in for a special appointment. The 100 patients that took her up on the offer had a 40-minute visit with Dr. Edwards set up on a day that she normally doesn't see patients to completely focus on weight loss, nutrition, and exercise. Dr. Edwards used this time to give her patients information about where they can safely exercise in the community. Participating patients can come back to Dr. Edwards' office every week to weigh in and can see Dr. Edwards every 2 or 3 weeks, 2 to 4 weeks, for a 20-minute discussion on their progress and challenges in losing weight. Making time for these short appointments with at-risk patients now can help prevent longer appointments and worsening health problems later. Dr. Edwards says, it's been really productive because the patients recognize that we care, and when the doctor is focused on them individually, they're encouraged to take action. And she said, when they're in the office for their 20-minute visit for their blood pressure or diabetes, I just don't have time to go over all those other things. And when I set time aside for 20 minutes to just focus on weight loss, we've seen people come off medication and improvements in their labs. So the first step, of course, is identifying the patients, but then the doctor came up with a strategy to use that knowledge that was pulled out of the electronic health record to actually focus on a specific target population. So another thing that is embedded, next slide, Selena, in the EHR are standardized treatment protocols or clinical decision support rules that can really help support a standardization of care. And they can be customized too, depending on your patient population and what your practice wants to focus on as a quality initiative. So ultimately, it's the clinician's knowledge and experience that determines the best treatment plan for that unique patient in front of them. But these clinical decision support rules are very helpful. It's kind of like, I think of it like the backup camera in my car. It's a nice safety feature. It helps, it's a tool, but I still have to do the driving. So same with the clinician. They still have to make the final decision, but these tools help. Next slide. So one of the many practices have patients that record, as mentioned and as shown in that video that Selena shared, their data in a home setting. And in that way, they get a more accurate reading. And many times they will bring the record of their tracked self-monitored blood pressure into the practice and have it included in their medical record. And then other patients, of course, have the option to enter their information into the patient portal, and the clinician can look at that between office visits, or some even connect to wearables. So these are all ways in which technology can help manage patients with hypertension. And it's really a much more accurate predictor when the patient records and shares these home monitored readings. It's a more accurate predictor of future cardiovascular risk, and it also allows the patients to actively participate in the management of their own blood pressure and has shown to improve adherence to antihypertensive medications. So on the screen, you'll see some of the resources that are available. SensorMed has a wonderful tool to help do remote patient monitoring with cellular connected devices. And of course, we know that practices can be reimbursed for using something like this for chronic care management that can add a great deal of financial incentive to the practice. And so we want to be aware of how these tools can help. As mentioned in that other example, the patient portal or a digital device or even something like our health information exchange, which Hybrid Solutions is a provider of for our Georgia practices to connect to larger institutions and also to other practices so that they can get a more accurate patient history shared through a secure, HIPAA compliant query of that patient, and also have a more accurate picture of their full list of medications that they're taking through that query as well. So these are all ways that technology can help manage, identify, support patients with hypertension and the staff in reaching those value-based payment goals that can have a positive impact on your reimbursement. So patient health and practice health. I think we have a poll question next. So how, in reviewing quality measures, creating a registry of patients with specific chronic conditions, as well as self-monitoring data from patients can be useful tools to improve outcomes for hypertension. True or false?
Okay, so we're gonna start the poll. Thank you, Phoebe. Okay, so everyone was correct. True. 100% true. Thank you guys so much for your participation.
We just want to remind you again that if you would like some assistance in looking at maybe participating in the hypertension management project, we'd be glad to speak with you about that and see if it would be a good fit for working with your practice to make some headway. Any questions?
And there's also a survey to, if you are interested in participating, there's a survey that we will send out to you guys to assess your EHR.
Well, we want to thank all of you again for attending, because we know that it's a privilege to serve you and to provide this information to you. We have lots and lots of resources around this topic, from Million Hearts, Target BP, from CDC. There's an overwhelming amount of information, and we're glad to just share a small snippet of that with you today, and how to highlight the use of the tools you already have in your practice, your electronic health record, and how maybe to think about using what's available there in a way that can focus on improving the outcomes for patients with hypertension. We have a partnership with 4Med Approved. Some of those trainings can be applied to processes like taking blood pressure correctly, and also for HIPAA training that needs to take place every year, and other healthcare related courses for continuing education credits. By using the coupon code listed here, you'll receive a 20% discount, and we hope that you'll take advantage of that. And here's our contact information if you'd like to reach out to us. We'll just leave that up there for a while.
Yes.
If anyone would like to contact us. And if you'd like to contact us to share successes or results, we'd love to hear those as well. Suggestions that we can include as we continue to do this work. So thanks again, everyone, for joining us. And we hope you have a wonderful, safe afternoon.